Good afternoon. Welcome to the College of Allied Health Sciences State of the College Address. At this time, before we begin, we'd like to recognize some special guests. At this time, when I call your name, please stand. We'd like to recognize you. At this time, we have the Georgia Health Sciences University President, Dr. Aziz. Also, we have Georgia Health Sciences University Provost, Dr. Kaufman. Please stand. And also, we have the historian in resident, Dr. Ellis Lowison. Would you please stand? Thank you. My name is Dr. Judy Stallings. I'm assistant professor in the Department of Physician Assistant and also a graduate of this institution and college. I graduated with a physician assistant degree and a Master of Health Science, Master of Health Education degree. Today, as an alum, it gives me great pleasure to introduce our dean, Dr. Andrew Ballast, as he makes his first State of the College address. Dr. Ballast's journey here was a remarkable one. He is a native of Hungary, where he received his medical degree and a master's in applied mathematics. He came to the United States in 1988 and earned a PhD in health informatics from the University of Utah. While still holding a green card, Dr. Ballast was appointed Congressional Fellow for the U.S. Senate Public Health and Safety Subcommittee, where he drafted the Health Care Quality Enhancement Act of 1999, the first federal agency to fund investigation into reducing health care errors. That same year, Dr. Ballast and his family became U.S. citizens, and shortly thereafter, he directed the Missouri European Center, an outreach program between his new country and the emerging European Union. He became Dean of the School of Public Health at St. Louis University in 2002, and Dean of the College of Health Sciences at Old Dominion University in 2004, where he stayed until he later joined Georgia Health Sciences University last year. His many affiliations and honors include membership in Phi Kappa Phi in the European Community Studies Association. He served as a fellow at the National Academy of Science Institute of Medicine and is an active fellow of the American College of Medical Informatics. In addition to serving as Dean of the College of Allied Health Sciences, Dr. Ballast has brought his considerable experience in public health to Georgia Health Sciences University as founding director of the new Institute of Public and Preventive Health. Please join me as we welcome Dean Andrew Ballast.
Thank you. Thank you. Thank you very much. Thank you very much, Dr. Stallings. And I'm very proud to say, did you hear Dr. Stallings? She just got her doctorate, and we are very, very proud of that, like many other faculty colleagues who joined us and grew with the College of Allied Health Sciences. Well, this was a very productive, very effective year with many, many great results. And actually, it was a historic year, and I'm very proud to say that it was historic for a number of reasons, but the number one reason for that is the consolidation of two great universities, Augusta State University and Georgia Health Sciences University. And it means that there will be a new comprehensive university, a wonderful environment for everyone who works here, who studies here, and certainly a wonderful environment for the College of Allied Health Sciences. It will be a university that is includes music, includes arts, includes language studies, includes a business school, includes health sciences, includes medicine. It's just a great place to work, and something that will be not only good for our graduates, for our faculty, but also an energizer, a true motivator of economic development in the area. So I think that this should be a wonderful, wonderful environment. As we move through the many accomplishments of this year, I would like to talk about the role of this university very briefly, then welcoming our new chairs and faculty members, talk about our job number one, which is our students, excellence in education. Our efforts to expand funded research, promoting health in the community, our intellectual potential, value and performance as we assess it and as we improve it, about the faculty practice, and then some of our new initiatives that we would like to bring to fruition in the coming academic year. This is our new mission and vision. And you know, committees get together and they come with drafts. Sometimes it's more on target, and this one is certainly very good, and it is actually approved by the Board of Regents. Our mission is to provide leadership and excellence in teaching, discovery, clinical care, and service as a student-centered, comprehensive research university and academic health center with a wide range of programs from learning assistance to postdoctoral studies. And I think this is a wonderful mission, and this is something that should add to that we will have Jaguars, right? I've always been dreaming about having a Jaguar, and now we are going to have a Jaguar, everyone. And actually, we will be Jags, right? All right, there is agreement in the room in that. So let's welcome our new chairs and our new faculty colleagues. And I'm very proud to introduce Michael Ivama, Professor and Chair of Occupational Therapy. Dr. Ivama, please stand up and welcome him. He's coming from Canada, and he's actually the creator of a very influential practice model, the CAVA model, that is used internationally and benefits a lot of programs, a lot of research everywhere in many, many parts of the world. So I think that will further enrich our already excellent occupational therapy program. Scott Hasson, Professor Hasson. Scott, please. Professor and Chair of Physical Therapy. And he is also the editor of the Journal of Physiotherapy Theory and Practice, a very influential journal, and also a seasoned department chair, someone who has many accomplishments and many experiences to bring to us. And Lester Pratlow is not a new faculty member, but a new chair. And actually, he served before coming to GHSU a number of years ago. He served he was one of the leaders of the laboratory services at Fort Gordon, the Eisenhower Hospital, and we really appreciate that. We would like to introduce the next new faculty members as well. Rebecca Roth, she is also coming from the military, so why don't we give them an extra round of applause and thanking them for their service in the military to this country. Tiana McCurry, Assistant Professor in the Department of Medical Laboratory Imaging and Radiologic Sciences. Dr. McCurry, thank you for coming. Ashley Fox, Assistant Professor of Physical Therapy. Okay, thank you. Natasha Glover, Assistant Professor of Respiratory Therapy. And Stevie Redmond, Assistant Professor in the Department of Physician Assistant. Thank you. Well, we had a great year in terms of our education and many accomplishments. Some of them are measurable, some of them are not measurable, but certainly what can be clearly seen is fall enrollment, which went up to 584, and that means that our graduate enrollment went up by about 5%, and our undergraduate enrollment went up by about 19%. And we are certainly very proud of that, and it really shows the strong interest in our college. I have to tell you that we are heavily lobbied to get into some of our programs. They are so competitive. So many people would like to get the outstanding education that they can get in the College of Allied Health Sciences at Georgia Health Sciences University. Our enrollment it certainly is here. You can see that our largest program by number is a physical therapy program. And then the next one is the physician assistant program, and the occupational therapy program is probably actually the occupational therapy is the second, and physician assistant is third in terms of size. And it's interesting to know that these three programs are actually nationally ranked and by the US News and World Report. And the physical therapy program actually improved its ranking during this past academic year. So why don't we give a healthy round of applause to the faculty members of these programs. This is truly wonderful, important achievement. The changes and the accomplishments were very much driven by our leaders, members of the Chairs Council, Anna Thompson, Dental Hygiene, Medical Laboratory Science, Lester Pratlow is the new chair, Bonnie Dadig, Physician Assistant Program, Laurie Prince, Health Management Informatics, Michael Ivama, Occupational Therapy, Randy Baker, Respiratory Therapy, Medical Illustration, Bill Andrews, Physical Therapy, Scott Hasson, Elizabeth Wark, Assistant Dean for Faculty Practice, Joe Cannon for Research, Associate Dean, and Academic Affairs, Student Affairs, Doc Kaskula. And I should also add that the chair of our Faculty Council, this year, Mariana D'Amico is also part of the Chairs Council. And I would like to recognize not just these people, but also those who were served as interim chairs throughout the year, since we are talking about the accomplishments of the year. And certainly Greg Passmore and Ben Hertz, I think that, they did a wonderful job in terms of, and Rick Wilson, they did a wonderful job in supporting the work and providing the coordination that we all needed. I should also mention that now there's a need for an acting chair in respiratory therapy, and Art Taft stepped up to the plate and accepted this appointment. And thank you very much, Art, for doing that. Student excellence. We cannot be more proud of anything than the accomplishments of our students. And we have very strong student accomplishments and the various programs. Here are a couple of illustrative examples. Lacey Campbell, American Society for Clinical Pathology, National Student Honor Award. Ryan Holman and Lee Nyquist, Association of Medical Illustrators Award of Merit. Lauren Labus, American Association of Public Health Dentistry Student Merit Award. Mandy McMillan, Georgia Association of Physician Assistants, 2012 Student of the Year. Donovan Pace, American Respiratory Care Foundation. Robert M. Lawrence, MD Education Recognition Award. And Irsha Washington, American Society for Clinical Laboratory Science, to the Keys to the Future Award recipients. So why don't we give a healthy round of applause to these students? They really make us very proud. These are our licensure exam pass rates, and as you see, many programs produce very good, very strong exam pass rates. And I have to tell you that some of the numbers that are lower are actually slightly misleading, because sometimes the national average is actually lower for certain professions, and health informatics come to mind. And actually, our pass rates are higher than much higher than the national average. And as you see, 4 programs are actually already reaching 100% in terms of pass rate. But as an ambitious dean, I already told them that I hope next year they will do better.
Dr. Ballast, physician assistant is 94%, right?
94%, yeah.
They have a mistake on that.
All right, 94%. Then a couple of facts about our accomplishments. 100% programs are fully accredited. Graduate programs ranked, 3 graduate programs ranked US News and World Report in the top 25, 30%. We have a very high retention rate historically across the board. CHS students enjoy a 100% employment rate or near 100% employment rate at graduation. More students and more graduates are coming out of our college than from any other GHSU college. And we had more than 1,000 applicants to our programs, very, very strong application rates, especially to some certain programs. 272 degrees conferred 2012. That many graduates went to the community, and I will talk about that. That many graduates will be making a tremendous difference in healthcare throughout the state and in other states as well. Programs are housed in state-of-the-art facilities. What a wonderful building. We all know other colleges are coming here, they are studying, they are dreaming about the future. And the best way to dream about the future is to come here and to see the reality where we are working. And this is a testament to this great support that we are receiving from the state of Georgia and from our university leadership. 63% of more than 7,500 alumni practice in Georgia. Well, faculty effort. I think that is important. I just would like to highlight the percentage numbers. Instruction, 61%. Of course, that's the majority. That's job number one, and it will always stay. The university name is changing. Some of the structures are changing, but the commitment to students, the commitment to excellence in education is not changing and will never change. Let's talk about research productivity. Research, the number of applications went up, and also the amount requested was higher in the past academic year. And then the awards that were actually received and the amounts that were received also went up. And I think it is important that we are making further progress in these research projects, and especially in terms of attracting external funding. And let's list a couple of projects and names and people who got funding. Abiodun Akinmutan received the National Multiple Sclerosis Society, a nice grant. Laurie Bogra from National Athletics Training Association, Charlotte Chateau from the CSRA Parkinson's Support Group, Raymond Chang also from the same group, Bonnie Dadig and the Physician Assistant Program from Hershaw Health Resources and Services Administration, Robert Gibson from National Institutes of Health, and also from Georgia Department of Community Health, Lynn Jaffe from Georgia State University, Pamani Rangashari from Agency for Healthcare Research and Quality, and Susan Whidden from Oridion Captography Incorporated, a corporate contract. Very, very nice projects, and we hope that over time we will have the success of these projects as well as additional projects. Our research, we published approximately 14 PubMed indexed articles, but it's very hard to measure because that calculates based on calendar year, so it's probably more than that, as 2012 is not yet over. Associate Professor Barbara Russell received the 2012 Kleiner Memorial Award and Distinguished Author Award from the American Society for Clinical Laboratory Science. Very, very nice award. And we are expanding research through a variety of ways, but one of them is launching new centers, and certainly among them is one of the most significant is the Center for Functional Assessment, and certainly this is an initiative that should give us new opportunities to expand externally funded research. And the university is on the path towards the recruitment of 150 new research faculty members, and it is important that we energize this effort and we make sure that we move forward with the recognition and with the use of this opportunity, and we fully take advantage of the great opportunity that is provided for us by university leadership. Well, let's talk about the community, how we need to move forward with our involvement in terms of being in the community. And if you look at some of the statistics, top 6 causes of all cancers in men and women, and what you see, top 6 causes or lifestyle and environment related factors. And actually a very surprisingly large number of those relate to our activities, to our opportunities, because these are the things that we can change in the community. And it is very important that we don't wait for the full evolution of these diseases. We prevent them at the time when they are preventable. And if you look at the various diseases, you see cancer, a large portion of that is actually lifestyle and environment based. Cardiovascular disease, an even larger portion, and frankly, I have never seen an injury that was not preventable. So it is very important that we do our best in spite of some of the challenges. And this challenge is in the next line, that the annual healthcare spending is mostly focused on curing diseases. So after the diseases already occurred. And I think it is important that we still use any and every possible opportunity to make a difference in the community, because that's the best place to change and influence health and reduce the number of illnesses and the disease burden or even mortality. So what's public health? Public health is what we as a society do collectively to assure the conditions for people to be healthy, a famous definition by the Institute of Medicine. And that is certainly applicable to our institution as it launched the historic initiative of the Institute of Public and Preventive Health at GHSU. And our college is a very proud supporter of that, and especially the initial phase required a lot of support by our college, and I certainly want to acknowledge the generosity and enthusiasm of our colleagues in supporting that and making sure that we have a strong start. It was opened in May, and it was a very successful conference that made great headlines, and we started a 6 months action plan. And that action plan is actually being implemented. One of them is community health partnership grants. And this is something we try to develop, and we got 26 applications in the very first year. So we were concerned that maybe the interest will not be there, and nothing could be more wrong. The interest is there, and people want to work with the community and want to partner, and the community wants to partner with academia. So that is certainly very, very good news. And the Institute is really a new and great and visible way of GHSU contribution to the health of the community that surrounds us, not just in the local area, but also statewide and beyond. Well, our college was quite active in being out in the community, and certainly we have been well represented in the Coastal Layman Nursery Employees Health Fair. This is a multi-year effort, and certainly we appreciate the colleagues who made a tremendous difference. Andrew Mazzoli, thank you very much for being so instrumental in organizing that, but many other faculty members, Ben Hertz and others, I won't even try to list everyone. They just made a great effort, and many students were there. And certainly we have an excellent partner, Debbie Lehman, who happens to be not just the manager of that nursery, but also a GHSU alumna. We had a free week-long Augusta area asthma day camp. Kitty Hernland led that effort, and for 44 children with asthma. And I think this was a good opportunity to help the community, but also involve respiratory therapy students. And then the physician assistant classes did a marvelous job in supporting the Christchurch Clinic, not just by providing patient care, but also by supporting the clinic with fundraising. And many of us were there, and I think that this is just a wonderful contribution again to the community. Well, our intellectual potential. Let's talk about that too. And there was a famous runner, Finnish runner, who made this statement, that quite insightful statement: mind is everything, muscle, mere pieces of rubber, all that I am because of my mind. See, that redefines physical therapy, right? And I think that we need to look at the intellectual potential that our college brings to everything we do. And our faculty distribution is actually quite healthy. We have 6 professors, 25 associate professors, 27 assistant professors, and 9 instructors currently. And you see that a number of them, about half of them, are either tenured or on a tenure track. But we can look at the gender distribution as well. And we have a male-female ratio 21 to 46, and then also the racial ethnic distribution in our college is quite remarkable. And I think that all this brings the kind of diversity that we need to productive scholarly discussions for a healthy work environment where people feel welcome, where people feel the opportunity of being productive and have a healthy opportunity for further growth. Our student diversity should also be mentioned, that the minority enrollment in our college is about 25%. I think it is an okay rate. We always need to work on that. There are always opportunities to do better. But I think it is, again, something that should show how our college contributes to every area's health in Georgia and elsewhere. And I think we want to provide a fair and balanced job in doing that, and certainly contribute to an environment that is inclusive, not just for the reasons of fairness, but it is inclusive for a stimulating academic environment. Let's talk about our financial resources, and certainly that is always an interesting and important aspect of everything we do. We have about a $10 million budget in our college, and a large part tuition and then state appropriations roughly matching. I have to tell you that the decrease or decline in state appropriations is not a Georgia-specific trend. It is everywhere nationally, and we may like it or not like it, but this is something we have to live with, but certainly something that should encourage us in terms of exploring the variety of revenue sources and being very active in generating new revenues as we move forward. And I'm sure that with good work, good collaboration, with good teamwork, we can achieve that. We are trying to deliver value, and I think it is very important that we deliver good value to our students and we deliver good value to our state. In recent years, our faculty numbers went down and our enrollment numbers went up. So our productivity has increased, and certainly we have some reserves. We can explore those reserves, and we should continue exploring those reserves. But at some point, obviously, growth will mean that we need more faculty members to achieve change or to achieve growth. There is the historic decline in state support. I mentioned that. Our college reduced the size and expenses of administration. Nobody says sorry for that, right? I think it is important that we have a healthy balance between teaching faculty and administration. We saved about $250,000 every year, and some of it was transferred actually to hire instructional faculty, because that's job number one, and that should get the best support. And certainly we are very proud that we had this opportunity to convert those savings. Shared governance is another thing. That starts with sharing the data. I mean, you cannot have shared governance without sharing information. And it is very important that we inform our faculty colleagues. So we developed some back-of-the-envelope simple calculations regarding program sustainability, regarding funding for individual faculty lines. And I want to express appreciation to our medical laboratory radiation imaging sciences faculty members that they come first, and they will participate in this evaluation, this initial review of our methodologies that should benefit the entire college. Our college has done quite well, and certainly it has produced the highest margin among colleges according to one university analysis. And also I have to tell you that when it comes to value, we have to take pride on that. The U.S. News and World Report actually lists several jobs: physical therapists, occupational therapists, clinical laboratory technicians, among the best jobs in America. So we are preparing people for the best job, and what a great value in difficult economic times. Educational program expenses. We started looking at the educational program expenses because it is very important that our students, our graduates, get affordable education. And obviously the total expenses, in-state tuition plus books and fees, are highly variable. I mean, not all programs have the same lengths, but we can generally say that our expenses are less than the first year salary of a new graduate. And I think this is probably a guideline that we may want to follow in the future as we make sure that we are providing affordable, high quality, actually I should say outstanding education to the citizens of Georgia and to everyone who is enrolled in our programs. Allied health sciences practice. Allied health sciences practice is an important part of what we do. This is our direct service in many ways to the community, and this is an opportunity for our faculty colleagues to keep current, and we want to make sure that this is a successful and expanding model, expanding service line. We did better than some of the projections, but still we could not reach the previous year. So I think this is an area where we need to explore new models to strengthen the revenue stream. And what are the new models? One new model, and most new models are based on that, on collaboration. And the first example that I'm giving you is the Low Vision Rehabilitation Center. That is a collaboration with the Department of Ophthalmology and Medical School. And I think that this is a wonderful opportunity to provide a much needed service to our fellow citizens who face the challenges of low vision. And we provide that with the leadership of Mariana D'Amico. And certainly this is a model that is more than just one clinic. It might evolve into a statewide network as we try to develop a more comprehensive approach to low vision rehabilitation. We are exploring some other new models of practice besides the enlargement of the low vision rehabilitation. One is the falls prevention, and another one is the oncology or cancer care, cancer rehabilitation initiative, and we will keep moving on that to make sure that we provide the care that is so much needed by the patients of this academic health center, but also by the community that surrounds us. In that effort, we are creating the clinical educator faculty role with higher than 50% clinical involvement. And we have high expectations that this model will be successful in advancing our practice. Our alumni, well, our alumni are just about everywhere in Georgia, and I would have a hard time, and probably it would be impossible to name any county in Georgia that does not have one or more of our alumni serving healthcare, serving with distinction and with great results, and we are very proud of what they do and what they achieve. We have about 7,500 alumni, and as you see, the overwhelming majority in the various programs are practicing in Georgia. So we are serving this state very effectively, and I think this is a very essential ingredient of quality healthcare throughout the state of Georgia. We also had a good year in terms of support for our college, and it is good to see, good to know that this year the number of our donations are up by 70%, 139 donors versus 80 donors in the previous previous year through August, and this is really a good doubling of the support for our college. And the majority of our donors are, not surprisingly, our alumni. They are our best ambassadors. They are our best supporters. And many current and past employees should also be mentioned. They believe in the good work we are doing, we are performing for the state, and I think it is very important that we count on that as well as expanding the support for the College of Allied Health Sciences and for the university. Our goals. Wow, a lot of excitement is coming with the new university, and we learned from the plans of the academic area for the university that there is consideration that we will increase the number of students over a number of years from 9,000 to 12,000, and we will increase the various degree programs, bachelor's degree programs, as well as graduate degree programs in the coming years. And this is exciting. This is a wonderful opportunity. This is like being part of the Lewis and Clark expedition. And let's not miss that opportunity. We want to be there. We want to have our fair share in the growth of this university. We want to have make our fair contribution to the development of new programs. I think it is very important that we do well in supporting these goals as they will be solidified in the coming months. So what are we planning in terms of academic programs? First of all, we have a number of plans. Some of them are more defined. Others are in the exploratory phase. But I can tell you one program that is definitely decided that we are moving forward and we are presenting it for approval, and that is the PhD in Applied Health Sciences, an umbrella program that should give us a wonderful opportunity to develop tracks in motion sciences, in laboratory sciences, in public health areas, in a lot of areas, and I think that this is something that should greatly synergize with the research mission, with the research ambitions of the College of Allied Health Sciences. We are intending to develop an occupational therapy doctoral degree program, additional Masters of Public Health concentrations. You know, this year we launched one concentration at the Health Administration, in addition to the already existing Health Informatics concentration, and we fortunately doubled the enrollment, and hopefully we can do it again. So there are a couple of new tracks. Environmental and occupational health track is actually in good shape and being presented for approval. Then biostatistics and epidemiology, and also behavioral health and health education, missing from the list, but it's important and it should be on the list. They are all considered in making this MPH program a comprehensive, all-encompassing public health education program. Master of Science in Nutrition. You know, nutrition science, it is an important area. It is something that has a profound impact. It's not just one of the many professions. And as you go back to the slide that I showed about the various diseases and cancer, you see nutrition is there. So it is something that is highly relevant to a lot of health, clinical initiatives, as well as community health initiatives. So we are actively exploring that. And speech-language pathology, audiology is something that we are kind of in a preliminary stage of exploration. Bridge programs for GHSU graduates, that's another category. And finally, I have to mention that the undergraduate public health program is also on the radar screen as a good entry to all kinds of health professions, including our college, including medicine, including nursing, and including many, many other areas. So perhaps we should think about the development of that program. So the plans are numerous, and not all of them, but many of them should come to fruition in the coming academic year. But I can tell you that our college has tremendous intellectual assets, tremendous leadership support. Certainly, I would like to express appreciation for the support of President Aziz and Provost Kaufman. Today, they are here with us personally, but throughout the year, they are supporting us in a variety of ways, and certainly we appreciate that very much. And we have a state that is very supportive of health sciences. I think it is important that we fully recognize that tremendous support. And with the new university, with Georgia Regents University, we can be very successful. We can achieve a much greater impact. And I think we don't want to miss that wonderful chance, and we will not. We will be very successful. So with that note, I think we can start a very active, very energetic, very focused academic year. And I wish much successes to all of us, to each and every one of you, as we move forward in educating the future of health professions. So thank you very much for coming.